Kankakee, DuPage, and Kane will all see the heightened resurgence mitigations already in place in Region 1, that's in northwestern Illinois. New restrictions were announced yesterday for Region 5, southern Illinois, so that means 4 of our 11 regions have triggered our fail-safe state action metric. By the end of this week, those 4 regions will be operating under the standard resurgence mitigations. That includes no indoor dining or indoor bar service, limiting in-person gatherings to no more than 25 individuals. As you may know, when the regional positivity rate averages 6.5% or less for 3 consecutive days, then the resurgence mitigations can be removed from those regions. If the positivity rate averages between 6.5 and 8%, the new mitigations will remain in place and unchanged. If the positivity rate averages greater than or equal to 8% after 14 days, more stringent Tier 2 or Tier 3 mitigations can be applied to further reduce spread of the virus. The new wave of the virus is disrupting small businesses in these regions, so they will receive priority consideration for the $220 million in the current round of business interruption grants. A description of the grants and an application form can be found online at dceo.illinois.gov. At this point, of the 7 regions that are still operating under Phase 4 of our Restore Illinois plan, that is without additional resurgence mitigations, 5 are now at a rolling positivity average above 7%, with the other 2 above 6.5%. All continue to show increases over last week, and most regions of the state continue to see increases in COVID-related hospital admissions. As colder weather approaches and flu season is upon us, we're going to see the rippling effects of these current unfortunate trends. The massive surge of cases in our neighboring states will continue to have a spillover effect. There is no easy fix for the effects of this virus on our economy and on our public health. But we will manage through this. We're Midwestern tough here in Illinois. We know how to deal with a crisis, and we know how to take care of each other. If you're getting tired and you've let your guard down, now is the time to pick it back up. Mask up, wash your hands, keep your distance. We have to manage through this until the effective treatments and vaccines are fully tested and ready for distribution. For now, to keep our economy moving forward and to get our kids back in school, we have to do our part to reduce the spread of the virus. We have to do this for each other, for our schools, for our small businesses. We can and we will. With that, I'd like to turn it over to Dr. Ngozi Ezike. Doctor.
Thank you, sir. Good afternoon, everyone. And of course, thank you, Governor Pritzker, for your continued leadership throughout this pandemic. I commend everyone who has taken this virus seriously since the beginning. It is not easy to take the right path. Sometimes taking the right path is quite hard, and that's very true in the situation we have here. But with your support and understanding, Illinois will avoid a much tougher situation than we find ourselves today. We still have a lot of work to do. We must continue to make strides against COVID-19 as the cases, as the hospitalizations, as the deaths grow each day throughout our state. Numbers throughout most of the regions are trending in the wrong direction. If your region does have the implemented mitigation measures, please, let's get on board and help our community to get back on track. It's been done before. We did it together as a state to get to Phase 4. Let's do what we can to progress further. We know what works. Wear your face covering, watch your distance, wash your hands, keep to smaller groups. Those simple actions keep you, your family, and your community safe. Another important piece, I can't say it enough, get your flu shot. I know many of you have never even gotten a flu shot, so why should you start now? Well, first of all, if you develop the flu for the first time, everyone will be looking to see if you have COVID. But you also don't want to run the risk of getting flu and COVID at the same time, nor do we want to use an additional bed for a flu hospitalization, as we don't have any definitive cures or vaccine for the coronavirus. Today, we are reporting 3,714 new cases of COVID-19 for a total of 350,875 total cases. Since yesterday, most regrettably, we have lost another 41 individuals for a total of 9,277 total lives lost. In the last 24 hours, 59,077 labs were reported for a total now of more than 6.8 million tests. In the hospital overnight with COVID were 2,261 individuals. Of those, 489 were in the ICU and 195 were on ventilators. These figures represent lives, parents, grandparents, co-workers who will not be with us at Thanksgiving. We have a deadly virus that is still prevalent throughout the state of Illinois. Let's please get together, band together, because none of us can do this alone. Individualism won't get us through this pandemic. We have to work together. Buenas tardes. Y gracias al gobernador Pritzker por su continuo liderazgo durante esta pandemia. De hecho, felicito a todas las personas que han tomado este virus en serio desde el primer día. Sin su apoyo y ayuda, Illinois estaría en una situación mucho más difícil de la que nos encontramos hoy. Sin embargo, el trabajo no está terminado. Debemos seguir avanzando contra el COVID-19 a medida que los casos, las hospitalizaciones y las muertes aumentan cada día. Los números en la mayoría de las regiones del estado van en la dirección equivocada. Si su región ha implementado medidas de mitigación, le pido que se suba a bordo y ayude a su comunidad a retomar el rumbo. Si ha hecho antes, lo hicimos juntos como un estado para llegar a la fase 4. No hacen más daño al progreso que hemos logrado. Sabemos lo que funciona: cubrirse la cara, cuidar la distancia y lavarse las manos. Esas simples acciones mantienen a usted, a su familia y a su comunidad saludables. Una pieza importante es vacunarse contra la influenza. No corra el riesgo de contraer la influenza durante una pandemia mundial. Hoy informamos 3,714 casos nuevos de COVID-19 en Illinois, para un total de más de 350,000 casos confirmados. Desde ayer hemos perdido 41 vidas adicionales, para un total de más de 9,200 muertes. En las últimas 24 horas se informaron más de 59,000 pruebas de laboratorio, para un total de más de 6.8 millones de pruebas hechas en Illinois. 2,261 personas en Illinois pasaron la noche en el hospital con COVID-19. De ellos, 489 pacientes estaban en la unidad de cuidados intensivos y 195 pacientes estaban en ventiladores. Estos números representan vidas afectadas, madres y padres, por este virus mortal que todavía existe en Illinois. Vamos a hacerlo juntos, porque no podemos hacer esto solos. Muchísimas gracias por su apoyo. And with that, I'd like to turn it over to Dr. Justin Macariola, Code.
Good afternoon, and thank you, Governor Pritzker and Dr. Ezike, for your tireless efforts in response to this pandemic, and for your enduring support of our frontline healthcare workers. My name again is Dr. Justin Macariola Code. I'm the interim chief medical officer at Advocate Aurora Sherman Hospital in Elgin, and also the medical director of the emergency department at Advocate Aurora Sherman Hospital. I'm also a resident of DuPage County and have been since 2001, and have lived in Chicago, or Chicagoland rather, since 1995. I'm a married father of 3 boys, all in school, one in Evanston, one in Elmhurst, 2 in Elmhurst, one in public school, one in Catholic grade school. So I really understand what families are going through during this pandemic. It's been a challenging time. I understand what our healthcare workers and parents, as well as our communities, are facing and have been facing for quite some time. We all suffer from pandemic fatigue. We've talked about it. It's difficult, but this pandemic is not over, not by a long shot. And we must press on. We cannot let our guard down. We are seeing an increase of COVID-19 hospitalizations across the Advocate Aurora system, and the percentage of positive COVID cases are rising. At Advocate Sherman Hospital and across our communities in Kane and the surrounding counties, we are seeing the start of what is most likely the second wave. Wisconsin is already surging, and Northern Illinois is likely next. The actions we take today to slow and spread the virus will define what happens in the coming weeks to months. Wearing a mask, washing your hands, and keeping distance from one another will prevent the spread of this illness and ultimately save lives. I myself have had the unfortunate event where both my mother-in-law and my mother have had major medical procedures during the pandemic, and my family's not been able to attend to them as they'd like to. It's difficult for everybody, for all family members, but we know what to do to keep them safe. If you must gather, please remain 6 feet apart. If you're inside, wear a mask. It's the only way to help keep the spread contained. But it'll take all of us working together to protect one another. If we do not take these basic steps, we won't be able to slow the spread of the pandemic and its potentially deadly consequences. And the harder it will be on our healthcare system, and we will put our frontline healthcare workers in danger as we head into this winter time. So please help care for our communities across the northwest suburbs. So this is an evolving situation. We have surge plans. We meet weekly to discuss the impact of the pandemic and what it may mean for our hospital. We work in collaboration within our system at Advocate Aurora to coordinate care, to reallocate resources as needed, to meet our patients' needs, to serve our communities. Now, as a reminder, if you have mild symptoms of COVID-19, it's best to quarantine and recover at home to reduce exposure of others, but seek medical attention if needed. The state of Illinois, under the leadership of Governor Pritzker, has put together an excellent free program to help you monitor your symptoms and get connected with support you need. We at Advocate are proud to partner with the state of Illinois for the benefit of our residents and for those that are COVID confirmed positive. This includes virtual check-ins, educational information that's available 24/7, alert monitoring, and in some cases, home monitoring kits, which include a thermometer, a portable device to measure oxygen level, known as a pulse oximeter, and other tools. Those in need of these services can call the COVID hotline on our website, advocatehealth.com. Listen, this is a highly contagious virus that can affect anyone. It does not discriminate. At Sherman Hospital, we've seen a disproportionate impact upon our Hispanic community, which we serve. As a large health system, we are committed to the education and the awareness of the virus, and we have included outreach programs and campaigns to our Spanish-speaking families. We know that this year, more than any other year, it's extremely important to get your flu vaccination. As Dr. Ezike had mentioned earlier, this is why we are offering at Advocate free flu shots for our expanding Hispanic communities as part of an effort to improve health equity and to ensure everyone has access to the flu vaccine. Now, everyone that's over 6 months of age should get a flu shot. It's never been more important than now as we're entering this flu season. And of course, we'll be fighting 2 viruses at once. Listen, we know what works to protect our families, our neighbors, our healthcare workers, and our community. Stay strong, keep up your resolve, continue to social distance, wear a mask, and wash your hands. Follow the guidelines. This is a call to serve one another in order to save one another. Thank you. Governor Pritzker, questions and answers.
Thank you very much, Doctor. Happy to take any questions from members of the media. Yes, ma'am.
I know no indoor dining for bars and restaurants and the counties that we need. Are there any other restrictions for gyms, churches, synagogues, schools that are private schools and that have already started hybrid learning?
Remember that all of the existing mitigations under Phase 4 of our Restore Illinois plan, those remain as they are. These are resurgence mitigations for areas where the positivity rate has gone up or where they've tripped other metrics, and that's where indoor dining, indoor bar service are being temporarily halted, and where we're reducing the number of people who can gather from 50 to 25. But you can find all of the mitigations that are associated with resurgence mitigations, Tier 1, Tier 2, and Tier 3 on the IDPH website.
Governor, can
Yes, ma'am.
Dr. Ezike too would weigh in on this? Yesterday, Dr. Arwadi spoke to worried about gatherings within the home.
Yeah.
And they also, the city, you all contradicted each other somewhat. The city is saying the spread is going on within the home and that restaurants and bars, they're not necessarily seeing that in their contact tracing. Is the state seeing that the spread is going on because of bars and restaurants being more open?
Yes, and there are pages and pages and pages of studies from around the world, from around the United States, not to mention articles that in fact, I believe we've sent these out to most of the media. If you would like them, happy to have my press secretary send them as well. I mean, we're literally talking about piles of these studies that show that bars and restaurants are spreading locations, significant spreading locations. It is also true, though, and I want to commend Dr. Arwady for saying, as she did, that private gatherings are another major spreading opportunity for the virus, something that we all need to be very, very careful about. It's not so much your own family that you're living in a pod with every day as it is when you're inviting either other family that don't live with you, friends over. I'm not saying you can't do that. All we're saying is, as Dr. Ezike said the other day, that it's important for you to maintain social distance even when you're having friends over. It's okay, 6 feet is not that far. Wearing a mask when you don't know them, that they've been tested or that they're COVID-free, it's an appropriate thing, making sure that people have hand sanitizer available to them, that they wash their hands, et cetera. These are all things that we're going to have to get used to, especially during this winter season, especially during the holidays when we know we all want to get together with our friends and family.
Governor, if I may
Yes, ma'am.
ask you, understandably, there's a lot of frustration coming from different quarters in those regions that are being rolled back again, especially
Yeah.
Region 7 already went through this a couple of months ago.
Sure.
Just a short while ago, I was speaking to one of the state reps that was on the call with Dr. Ezike earlier this afternoon, where she was telling her about this rollback. The point that she was making was this. She said that on the call, Dr. Ezike had mentioned that bars and restaurants account for the lowest number of cases in the current surge. And so if they're at the bottom of the list for these new surge, why are we affecting businesses? Why are we rolling them back when maybe the benefit from it won't really be what we would like to see?
I have my own thoughts, but I want to
No,
let
I just-
Dr. Ezike answer for what
I just want to make sure that I wasn't mischaracterized. maybe you can hear me. So the issue is, on the call earlier today, they wanted to say, why do we keep going after bars and restaurants? And so as we look from region to region to region, statewide data, we look at the places, this is again from our contact tracing efforts, we have the individuals who have talked to the case, and then the questions include looking back where they have been in the previous 14 days. That is where, those are the places that they have been where they could have caught the virus. And then we also look forward to since they've been symptomatic where they've been. So that's the place that they could have given the virus to, and exposed others. And so when you look at the top 3 places that come up over and over, region to region, statewide, it comes up as people's workplace, it comes up as school, it comes up as restaurants and bars. So we're not going to not have people go to school. We're letting the local health departments and the school administrators decide for themselves what's appropriate regarding school. And then in terms of workplace, there are people that you cannot work from home where you have to go to work. So the next thing that we can actually act on is the bars and restaurants. Okay.
But according
Well,
to
how
Dr.
might this affect the
Zeke-
number of
Dr.
people in the
Zeke-
classroom though? Because if the rule is now 25,
Yeah.
are there any classrooms that have more than 25? What should they do?
Yeah, so again, the rule for the class, and this is not supposed to be for schools specifically, but I know even as we worked so closely with the schools and the local health departments over the summer, that in the classroom, they're supposed to be spaced out, the 6 feet, and masked. And so depending on the classroom, they can figure out how many people they can fit, but we've already accounted for and expect that there is 6 foot of distancing and masking in the school setting.
Yep. And there are guidelines, let me just add that there are guidelines, as you know, that were provided to all the schools from the State Board of Education to make sure that schools know what they should be doing. But as I've said all along, that schools are different locations from one to another, even within a school district, as you know, putting Chicago aside for a moment. Outside of Chicago, there are many, many schools, multiple schools in a school district, and they're all laid out a bit differently. Some of them have many fewer students than the next school that's in their school district even. So we want the schools to make decisions about how to space people out, how to make sure to keep them safe within the school. But our goal, our number one goal, is to make sure that we get our kids back into school as it is safe. So hybrid learning, a good idea, and of course in-person learning, a good idea. Again, at the local level, school boards and school administrators making decisions to keep those kids safe.
How might this impact your decision on winter high school sports? If this is what's going on as far as more restrictions, might we see high school sports for the winter being played?
Well, let me begin by reminding you why we're here 2 days in a row and why we're now having a daily press conference about COVID-19 again. And that's because we are seeing a national surge of cases that is affecting every state around us in a dramatic way. And in Illinois, we are seeing the numbers go up literally all across the state. And so we are going to be very careful about whatever guidance gets issued for school sports for the winter, as we've tried to be careful about everything that we're doing so that we don't have a significant surge. Illinois has done a better job, I think, than most states, certainly the ones surrounding us, and we'd like to keep it that way.
Governor Pritzker, could the CDC change the rules? I think Dr. Zeke talked about this. We're now taking into consideration antigen tests, which are rapid tests. Why now are antigen positive cases being added now? And do you think that has to do with the increase in cases, not just in
No.
Illinois, but nationwide?
I don't know about nationwide. I can tell you what's going on in Illinois. Let me start with this. We already have a robust testing system that didn't have antigen testing in it. That's because the percentage of tests that are being done that are antigen oriented up to now have been very, very small. I think you can see, I think we announced that it was something like 1,000 or 1,200, out of the 50 or 60, 70,000 that have been announced over the last couple of days. The reason that we're now including antigen testing is because we're now getting resources from the federal government that are antigen tests. And we want to be able to use those tests for surveillance testing, which is a very important thing for us to be doing in the state. And so we'll be reporting those. But we've separated them out. People can see the numbers of antigen tests. Right now, it's a very small percentage. I think 1% to 2% is the total number out of all the tests. What's that?
You're separating them out?
We are. We'll be. You'll be able to see. Yes, you'll be able to see it. I don't know whether we've got it up on the website yet, but that's the point of it. Is we want you to be able to see the separate tests, but we also want us to be able to calculate the positivity rate using these tests because they're useful for surveillance testing, which is part of how you get to a positivity
Do
rate.
you foresee another stay-at-home order?
I'll come over here in a moment. I promise.
Do you-
Yeah.
Do you
Go ahead.
foresee another stay-at-home order, and if so, what will it take to get there?
It's not something that we're considering right now. As you know, we have this resurgence mitigation plan in place. It's been working as regions have gone in to the resurgence mitigations. They've been able to lower their positivity rates and come out of it. It takes a little longer for some regions than others for reasons I can't explain, but they do come out of it. So we're going to continue with the plan that we're on. That's a regional plan. Yes, ma'am.
Just go back to the question that I'd asked earlier and didn't get your response on it, of why roll back businesses when we're not seeing maybe the benefit from it that we would like if most of these communications are in fact coming from at-home gathering?
But we are seeing the benefit. In fact, we saw it in Region 7. We saw it in Region 4. Those are two regions that we put into this very same set of mitigations where we limited or actually eliminated temporarily indoor bar service, indoor dining. Those were two of the things, limited the amount of people gathering. And you saw those positivity rates come down in both of those regions. So it does work. And indeed, it is an area of spread, as Dr. Ezike did say, and we are seeing it in our contact tracing. So, this is an important area to focus on. Look, this isn't about punishing anybody. We're not focused on, we didn't pick it just because it sounds good or that we want to do it. It's because all the studies that have been done about bars and restaurants show that these are significant spreading locations. And we want to stop the spread. We want to slow the spread as best we can. And so we're putting mitigations in on a targeted basis to make sure that we bring down our positivity rates so that those businesses can reopen to indoor service. And sorry, one right here. We haven't taken one.
Yes, thank you. We talk about COVID fatigue. For months and months and months, we've been telling people, wear your mask and don't have parties. And at some point, that starts to become white noise. Do you feel, each of you said, wear a mask, keep your distance. Do you feel like the current strategy is still working to get that message to residents?
Yeah. I do. And what I know is that wearing a mask works. What I know is that social distance works. Do I think that the messaging works? Sure. Look, there are a lot of people that have resisted because they didn't know anybody who had COVID. They didn't know anybody who got sick from COVID-19. There are a lot of people that aren't paying a ton of attention. They, of course, turn on the TV, they hear about COVID, and they say, I don't want to hear the bad news. The truth is that as time has gone on, lots and lots of people have come to know somebody that got COVID-19 and got sick from it. And I particularly want to, and I said this the other day, at the early stages of COVID-19 back in March and April, I think there were many people who lived in rural areas of the state, who didn't see many cases and they didn't see many people getting sick. And they looked at Chicago and Cook County and the collar counties and said, that's a problem for them. That's not our problem. We don't need to change our lives. And so for several months, there were people that resisted wearing masks. They weren't really listening to it because it wasn't affecting them directly in their communities, or seemed not to be. That situation, to some degree, has reversed. That is to say that Chicago has one of the lower positivity rates in the state, and it's the rural areas of the state that have the highest positivity rates. You're seeing that in Wisconsin. You're seeing that in Iowa. You're seeing that in Indiana. And so we need to make sure that people hear the message again. Because now I think it's personal to people. It is local to people. They do understand it. And when they hear from a local doctor, when they see that their local hospital is getting fuller, when they know people who are getting sick from COVID-19 and having sometimes long-lasting symptoms, I think then it's real. It's more real to people. And so, yes, I think that although people feel fatigue from all of this, and I know we'd all like to go back to the lives that we were living before we ever heard the words COVID-19, the truth is that we're going to have to tough this out for a little bit longer. We do see progress on vaccinations. We do see progress on treatments, and I'm very, very hopeful that in the spring, that more and more people will have those things available to them.
What does this mean for the Joliet Casino? It is Will County's largest employer?
So the same rules for every region that goes into these resurgence mitigations. They have to close by 11 p.m. And they're under the same. That's another one of those under the list of tier 1 mitigations under the regional resurgence mitigations. So there's some mitigation there as well. Sorry.
Only 25 people inside, or?
I can't remember the exact, terminology that's in the resurgence plan for casinos. My apologies. There's a lot of detail in there, but I can at least tell you that they too are going to have to make some changes to the way they do business. Thank you.
I'll get you the casino stuff right here.
Thank you.
And the bars and restaurants.
Jordan, can you mail out the advanced email to bars and restaurants? The studies? Yes, that'd be very helpful. Thank you.
Oh, yeah, no, we gotta do it now, then. Oh, yeah, yeah.